Hey everybody, I wanted to do a quick training on the secret to an absolutely awesome one-on-one. So a one-on-one is you've done a group report or you've done a individual report, doesn't matter how you do it, but you're about to give them an idea of their results and you're about to give them an idea of what type of recommendation you're going to give for them going forwards. Um, the idea of that portion, the best, and I've tried it every way there is, I really have. And what I've found over the last 10 years, our conversion rate, whatever you want to call that, and the number of people that have an evaluation that end up starting care has been consistently over 96% for 12 years, and it's been over 99% for the last 10. So, and I only have 12 years of stats, so I did it for that whole time, and then the last 10 years I've been doing it a specific way, and that's this. I ask questions. I give them enough information during the report, during the new patient exam, in communication with them before the new patient exam by email, in communication with them after the report, after the new patient exam and before the report. So they've gotten enough information before the one-on-one so that I can just ask questions. See, if during the one-on-one you're giving them basically the equivalent of a doctor's report and you're trying to explain the problem, by the time you get to that, they should already have decided emotionally if you're the right doctor for them and logically that this makes sense to them. So the report is just you telling them. So you just, it's just a couple simple questions. It's, do you have any questions? Right? Do you understand the problem? Yeah. Would you like help with it? Yes. Right? Might just say to them, when somebody comes in as a patient, what I'm looking for is really simple. Do they have a problem that chiropractic can help? And the answer is yes. So then the other part of the question is, does the patient want help? And you have to answer that for me. And they say, yes. I'm like, are you sure? Yep. And you're going to start out 3 times a week, like we talked about in the report. Do you see any challenges with that? No. We'll be starting off or 4 times a week or twice a week, whatever the case is. It's going to be 3 times a week, then twice a week, then once a week, and then every other week. It's going to take about a year to stabilize it. You're going to start more frequent to do a series of exercises throughout. That's sort of the way that it works. You'll end up with 80 adjustments or 59 or whatever the case is, and the total amount is going to be about 3,500. And then I just break it down for them. And then I just say, we have a bunch of different options on how to pay in the office. I don't care what you pick. You just pick whatever's best for you and your family. So option 1, you can save 20%, like I mentioned earlier, because again, you're just reiterating stuff you've already talked about. So first option is one that most people pick because you save the most. So you can pick that, or you can spread it over 5 payments or 10, whatever you like. So if you're more of a budget person, then spread it over time. If you're more of a discount person, then pay it all at once. Does one of those work better for you than the other? And they just say, I like the discount. Yeah, okay. Or I want to pay over time. Okay, I don't care. So they pick that, and then we give them their adjustment. The one-on-one should involve the details of how to get the care. Just like during the doctor's report, your idea of the close is you give them the meat of the close early, and at the end is when you give them the detail of how to get the free appointments. Well, the whole idea of the report is to give them all the idea of what they're about to find out. That way, during the one-on-one is just how to get there, right? So a lot of people, they worry about the one-on-one. If the person hasn't already decided by the time of the one-on-one that they're totally in for care in your office, you could talk them into starting care, but it'll be a weak start and you'll feel like a salesman, like you're selling something, and nobody wants to do that. It all comes down to pre-planning, making sure you're getting them educated before you're ever asking them for a commitment. If they've figured out that it's both emotionally relevant to them and it's a logical choice for them, and you make it easy for them, then the one-on-one should be a piece of cake. If your one-on-ones are taking 15, 20 minutes, you got a problem that your report isn't good enough, your new patient report isn't good enough, or your communication before that point isn't good enough. Okay, evaluate your one-on-ones this week, see how they're going, look where the roadblocks are, and figure out, is there any way to answer any objections that come up during the one-on-one well before the one-on-one ever takes place. It's the same secret that everything else. If you can kill the monster when it's small, all these procedures are going to be super easy for you. All right, guys, have a look at that process this week, and we'll talk to you guys soon.